I'm Tom Miner. I practice pulmonary and sleep medicine with Boulder Valley Pulmonology in Boulder and Broomfield counties. The average adult needs about 8 hours of sleep every night in order to be fully refreshed and function normally. As we age, we tend to need less sleep. Patients over the age of 65 may do fine with only 6.5 to 7 hours of sleep, but rarely less than that. Children and adolescents need more sleep than adults. A typical 10-year-old child needs about 10 hours of sleep a night. That can be challenging, especially with early school start times. A lot of people think they can get by with less sleep, but when we really look into it closely, we find that they're often not functioning as well as they could be. People have different circadian rhythms, meaning the time that they're most likely to be awake and likely to sleep can vary between different people. Some people are inherently just morning doves, meaning they can go to bed early and they can get up early and they feel fine from the moment they wake up. Many people who have difficulty waking up in the morning are night owls. They naturally tend to be very awake and often very productive well into the night, but then have difficulty waking up in the morning. By taking melatonin a few hours before bedtime, we can help pull our natural sleep time forward. The other tool that we can use to change our sleep time is light. Using electronic devices such as televisions, computers, and even iPads can delay melatonin release and actually delay the natural time that we want to fall asleep, and therefore delay the time that we're naturally ready to wake up. By eliminating those from our evening routine, say a few hours before bedtime, turning off all those devices and reading or doing something else relaxing, that can help us fall asleep earlier and therefore wake up earlier and feel more refreshed. The timing of meals can definitely help you fall asleep. Much like an afternoon lunch can tend to make people feel sleepy, having an evening meal can also help sleep as well. There's no foods in particular that can improve sleep, but avoiding caffeine is certainly important. People need to remember that caffeine can be found not just in coffee and tea, but also in chocolate and in some other sources. Exercise can definitely help get better sleep. It's best to do exercise not right before bed, but at least a few hours beforehand. The exercise should be vigorous enough to actually make you sweat and get your body temperature up. That rise in body temperature is usually followed by a fall in body temperature, and it's when your body temperature falls that you're most likely to get into sleep. There's also evidence that you doing the same thing by getting into a hot tub can help, again, by raising your body temperature up. Then when you get out, you cool down, and that helps you get into deeper sleep. Sleeping in a cold room can also help for the same reason. Your body sleeps best when it's a little bit below the normal body temperature and is allowed to cool down. Turning that room temperature down into the mid to low 60s can definitely help. Sometimes some of the things that work to help us get to sleep as children, like having a good bedtime routine of having something small to eat and taking a bath and then maybe reading a book, can actually be very helpful for adults to help them get to sleep.